Hey guys, and welcome back to XL Medical Spa. My name is Khan. I'm one of the providers here, and here's another episode, and hopefully this is going to be a fun one. I don't think we've done an episode on cellulite yet, but it's something that's a huge concern for women, and it's something that we don't necessarily know how to tackle or why it even occurs in the first place. So let's talk about the why in regards to why women predominantly get cellulite. Men can get it too, but why women get it, the anatomy behind it, and then what are some of the treatment options that we can do to treat cellulite. Alright, so what is cellulite and why does it occur in women? So it's hard to get a definitive answer, but some of the things that we do know or understand is cellulite can come from genetics, comes from what type of sex you are, so male, female predominantly, your body size, puberty, a little bit of hormones and things like that. So why do women get more cellulite than men? And then where do we generally get it? So women carry their fat mostly in their thighs, their buttocks, and their hips. Whereas men, we carry fat more evenly distributed or more vertically up and down. So if you imagine columns, think of Roman columns. So little Roman columns, what happens is women have these fibrotic cords that run vertically on your hips, thighs, and a couple other places throughout the body. But what happens is between those cords, between those Roman columns are pillars of fat. So if you can imagine, and I'll pull up a picture, is you have this fibrotic cord and you have this fat pocket that sits here. You have another fibrotic cord and another fat pocket that sits right here. So what happens is, depending on, we'll talk about this in a bit, but what happens is these fibrotic cords act as a little bungee cord. So if they're tight right here and you gain weight or you just naturally pocket fat this way, what happens is the fat bulges above the cord. So you have a cord that pulls down and you have this bump of fat. Next step over, you have this cord that pulls down and you have this pocket of fat. So what happens is why we get the orange peel, why we get the cottage cheese thighs or buttocks is you have these undulations. So the dip is the cord pulling down and the bulge is the fat pocket pushing up. So some of the causes we understand is genetics. So if a mom has it, the aunt has it, then it'll commonly occur in the daughter. Now the other part of this is, does exercise play a role? Does age play a role? Does weight gain, weight loss play a role? So if you look at someone has a higher BMI, body mass index, they may have more proportion of cellulite. So what happens is, again, this tethering band, if you have a larger fat pocket, it's gonna push up more and cause that bulge. Now conversely, I have women come to me all the time. They're super fit, super active, and they tell me, Con, I run all the time, I exercise all the time, and no matter what, I will still have cellulite. Because no matter how much working out you have, women just naturally have a higher content of body fat. So if you have a genetic predisposition for these cellulite, for the cords, no matter how much you exercise, no matter how much you tone your legs, your hips, your thighs, you'll still have the cellulite. So that's why there's a proponent of genetics involved in it as well. Now, does ethnicity play a role? Maybe. I think with darker skin tones, I think sometimes you can hide it a little bit better. With lighter skin tones, when light reflects off the skin, you'll have a play of light and shadows. So I think the lighter skin you are, sometimes you can see the cellulite even more. Now, does hormones play a role? Can't definitively say yes or no. I'll link a description to go to the Mayo Clinic. Mayo Clinic has a lot of good information on it. But what happened is post-pregnancy, aging, hormone changes. So if we know hormone changes occurs with pregnancies, we know hormone changes occur with aging. So is it the aging process? Is it the weight fluctuation when it comes to pregnancies? Or is it the hormone fluctuations that cause it as well? So those are some of the things that may cause cellulite or give you more of a predisposition for cellulite. So now that we have an understanding of what cellulite looks like, who gets it and why some people get it more than others, how do we treat it? So of course there's over-the-counter stuff. We've seen the creams, we've seen the rollers, the jade rollers, I can't remember the word off the top of my head, it's guangzhou, it's in Chinese. You have these big metal plates that you just rub over your body to help break up those bands. So essentially what you're trying to do is you're not necessarily trying to treat the fat pockets, because we've already discussed that no matter if you have weight gain or weight loss, some people just have a predisposition and you'll have the cellulite no matter what. Now, what you're trying to treat is those bands. So how do we eliminate those bands? How we cut those bands? How we dissolve those bands? So one of the treatments I do, and not at this practice, but if you want to come see me at La Jolla, you can come see me for cellulite treatments. I do quite a bit of them there. So what we're trying to do is mechanically release the bands. So there's a treatment called Cellfina, C-E-L-L-F-I-N-A, and of course I'll link a description below. It's called Cellfina. So what we're trying to do is these bands, these Roman column pillars, is how do we get rid of those bands? How to get rid of the pucker that they cause. So if we release the bands, the intent is release the pucker, and you'll have a more even distribution of skin texture, and then also an even more distribution of fat. So what Cellfina does is, it is a non-surgical treatment, minimally invasive, but what we're trying to do is identify the dimples, and most people what I treat on is I treat the hips, the buttocks, and then the posterior thighs. That's predominantly where I find most of the cellulite. Can you get cellulite in the front of the thighs? Yes, but typically what happens is that's more of an aging process, collagen loss, and laxity of the skin than it is cellulite. So we can talk about how we treat body treatments and laxity on the body parts, but specifically for cellulite, that's generally where I treat is the buttocks, back of the thighs, and the side of the thighs. So I'll try to link some videos to Cellfina and what it does. But essentially what you do is you come to the practice, we give you some pain medications, and we give you some anti-anxiolytics to put you in a happy place. And then we mark the buttocks. So I usually have an assistant with me, but we're trying to identify what is truly a cellulitic dimple and what is maybe just skin laxity. So what we'll do is we'll go throughout the buttocks and we'll mark. We'll mark all these little dimples, and typically on the buttocks, you'll have these round dimples. On the thighs, what you'll see is you'll usually have these side-to-side linear bands, and I'll try to put some pictures up here for you. So dimples on the buttocks, usually just traditional dimples. And then on the back of the thighs, you can have some dimples, but usually you have these bands running across the back of the thighs. So myself and a medical assistant, and we'll mark it, and then we'll play with shadows. And because our clients tell me this all the time, they'll say, hey, in certain light, it looks worse. Because usually it's that downward light that casts a shadow on those dimples that makes us look at the cellulite a lot more. So we'll play with different lights, we'll put flashlights in different places, and we're just trying to identify all those dimples. Once we do the markings, we lay you face down onto a procedural table, and at that point we start the procedure. So the first step is to numb the entire area. So we have a special apparatus for the Cellfina, and what it does is it injects lidocaine throughout the entire treatment area. So with that lidocaine on board, you don't feel any pain at all. Usually the most uncomfortable part of the treatment is actually just the injection of the lidocaine, because it burns a little bit going in. But after that, you're completely comfortable. So during the entire procedure, you have pain medications on board, you fully relax, and if needed, we give you some Pronox as well. Pronox is just laughing gas. It just helps you put you in a happy place. And then we proceed with the treatment. Now that you're fully numb, now that you're fully comfortable, how do we actually release the cellulite bands on your body? So with the Cellfina, what we're doing is we're using a vacuum. So with this vacuum, we are sucking the skin up as high as possible. So by sucking the skin up, we're also pulling the band close to the surface. At that point, what I do is I take a little blade, and it's an oscillating blade, and I put it into the skin that's suction up now, and hopefully I'll pull a video up here so you can see as well. But what we're doing is we're putting that blade right into where we identified the band is, and then we cut that band. So if you can imagine, again, bear with me, imagine you have this rubber band that's pulling down on your skin. If we cut that rubber band that's pulling down on your skin, then we unpucker and release it. And that's what we're doing the entirety of the buttocks and thighs. So typical most treatments, anywhere from about 20 to 30 total dimples and lines. So we attack each individual dimple. So by identifying each dimple, we're not just broadly going in there, sweeping and cutting and causing unnecessary trauma or excessive bruising and swelling. We're really attacking the actual individual dimples that are causing the cellulite on you. Now, after we've released all the dimples, we clean you up, we put you some antibacterial cream on you, and then we put some, pretty much what they are Spanx. They're surgical tights and stockings, because we want to keep everything compressed. By keeping everything compressed, you're reducing the heal time. You're also reducing other risks, including like seromas, which are collections of fluid. So by compressing everything tight, we're just pushing all that fluid out and making you more comfortable. Post-care, there's not really much involved in post-care. You can go on light walks, but we just don't want you to have overexertion. You're going to be tender, you're going to be sore, and all that lidocaine that we inject in you, it just expresses over the next day or two. We give you plenty of gauze and plenty of dressing changes. But for the next couple of days, you're just taking it easy. As long as you're doing light little walks, it just helps expel that fluid. Now, could you have some bruising and swelling? Absolutely. For the most part, the bruising isn't too bad, and typically what we do is we recommend it during the winter times or the fall times when you're not in bikini season, and then also outside of any special trips or vacations where it could alter the way you look as well. Now, if you do bruise, that the La Jolla practice that I work at, we do have a laser that helps expedite the bruise process. So even if you do Botox fillers or any other procedure that we do, if you get a bruise, we zap it that day, or if you get a bruise, you just come back to us daily and we can zap that bruise as well. But that is Cellfina. So what we're doing is actually physically cutting the cellulite bands that are causing cellulite. Now that's the actual procedure. So the common question is, how many times do I have to do it? How often do I have to do it? And is it permanent? Now with Cellfina, usually it's a one and done. So I recommend it once within the year, and then your peak results are around 3 months. So after we cut the bands, you have swelling, you have tenderness, and you have the bruising. So we want all that to go away, and we want your body just to heal back up. So we say a full 3 months, come back, take pictures, and we can really identify how much progress we made. And for the most part, every time I've done Cellfina, I've only done it once. Now we have other procedures that we can really fine tune. So say you had 20, 30 dimples, and we've corrected 90% of them. So now you have 2 or 3 dimples that are just bugging the heck out of you. So rather than going under the whole Cellfina process again, we do have other treatments that is a little bit quicker in regards to you just being in and out. They're not as effective as Cellfina, that's why I always do Cellfina first, but after that we can fine tune, and then you're just in and out of the office in 15, 20 minutes to really fine tune it down. We'll talk about those other procedures on another episode, but that's my go-to treatment when it comes to cellulite for women specifically.